I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go. Welcome to everybody that's watching live and that will watch on replay. This case comes out of Utah, and we are all following the Corey Richins trial. And in the midst of all of that, I got an email from, I believe, Miranda. And so thank you, Miranda, for sending me this case. And I watched the opening statements and I was hooked because I heard the title that, okay, a friend, supposedly a friend who is a nurse, is on trial for unaliving her friend that she thought was terminally ill. But this case goes so much deeper. So this is the trial of Megan Sundwall, and she is a registered nurse. And back on August 12th, 2024, she goes over to her friend's house and she's going to allege that her friend gave herself a lethal dose of insulin, but she went over there and she did not call the police at all. And at some point, the friend becomes unconscious, and Megan is texting her mother, canceling her dinner plans and saying that she's really concerned about Casey. And Megan's parents come over to where Casey is living. And so I think Megan's family is Mormon. And so blessings came up. So patriarchal blessings came up in this case. But uh, Megan's father and mother, I say father, but it's her adoptive father. Her biological mother and her adoptive father were there when Casey is lying, she's not really conscious because her blood sugar is dropping rapidly. By the time she makes it to the ER, her blood sugar is so low, they can't even get a reading. And Megan is saying she has a DNR. And for years, Casey had been complaining about having terminal cancer. And come to find out, while Casey is in the hospital after this lethal dose of insulin, come to find out she never had cancer. So there are messages between Casey and Megan. Megan is the one on trial. Casey is the victim. Casey told Megan that she was going to inherit. I've heard 1 million, I've heard up to 1.5 million, but that Casey was the beneficiary of her life insurance policy. But there was no life insurance policy. So this case brings up somatization versus fictitious disorder. We used to call it Munchausen by proxy. So somatization is where somebody truly believes. So a somatic disorder is where somebody is experiencing mental health symptoms as physical complaints. And so a person might legit think they have cancer and start to seem to have signs and symptoms of cancer, but you go to look and there is no cancer and it is a somatic complaint. This was not the case because Casey actually had knee replacement surgery within, I think it was 6 weeks. It was either in June or July. Casey had knee replacement surgery and she never told any of her doctors that she had cancer. But she had been telling her family since 2015 that she had terminal cancer. I want to talk a little bit more about the victim, Casey, because she was born, and when she was about 3 weeks old, it's my understanding, according to her sister's testimony, she had a perforated bowel and they had to do immediate surgery, and they realized that she only had one kidney. And so throughout her life, she did have medical issues and concerns related to only having one kidney. At some point, her primary care doctor also testified that she had been using ibuprofen a lot to the point where it caused some kidney damage, and so she ended up with a port. So for people that do have cancer treatment, or if they have dialysis, or if they have major medical concerns, sometimes people will have a port, because everybody in the family knew that, or thought, everybody in the family thought that the medical supplies that were being mailed to the house, that was for cancer, but the port was actually related to her kidneys, and she was getting saline. It was actually saline. And Casey would have her sister take her to medical appointments. She would have her uncle take her to the medical doctor. All of these, and her family legit thought that she had cancer. And so fictitious disorder is where somebody feigns an illness. They pretend to have an illness in order to get attention or support. Sometimes people are doing that to get attention and support from the medical community. Sometimes they're doing it to get attention and support from their family and friends. I also want to mention that Casey's mother died from complications related to type 1 diabetes. And possibly, based on the sister's testimony, it sounded like their mother had a kidney replacement, or, yeah, a kidney transplant. And following complications, so when Casey was about 3 years old, her mother died. And then when Casey was about maybe in her like 20s or so, her dad died too. And her dad died. It was multiple medical things, but a lot of people in her family had type 1 diabetes. She did not have type 1 diabetes, but her uncle that she lived with, and because she lived with her uncle and her grandparents. Come to find out, Casey had also been stealing, or there was $68,000 used without her grandparents' consent. And so Casey had been using her grandparents' credit cards without their knowledge, and they found this out after her death. It also turns out that Casey there are allegations that she was using prescription pills that were not prescribed to her, so Xanax, and then also that she may have been overusing opioids as well. And all of that to say, but when she told her friend Megan that she was terminally ill, at one point, Megan tells her to just die. Not really, but like the gist of the message was like, don't hold on, like just go. And then Megan, I believe, is the one that recommended insulin. Let me get to my notes because we are going to break this down. So I was surprised during opening statements, the defense pretty much said that Casey was exhausting. And I do believe either the defense is going to call a mental health expert, because I think the defense's theory is that Casey did this to herself. But even if that's true, and but there are messages where Megan is telling Casey to go on ahead and use the insulin. And at the time of Casey's death, Megan was struggling financially and needed the money. So, like, this whole case is just a lot. It really is a lot. And so I do think that Casey likely had significant mental health issues, and that she was engaging in attention seeking behavior. Because while Casey is telling Megan that, you know, she's telling, according to Megan and Megan's family, I guess, Casey was supposedly telling them horrible things about her family. Casey was telling her sister that Megan was trying to kill her. So when the uncle realizes, Megan, so on the day of the incident, Megan never calls for help. I believe the police are called, maybe it's around like 8 or 9 PM, because Megan's parents come to the house and the uncle realizes, so Casey's uncle realizes that nobody's talked to her or really heard or seen her all day. So he goes down to their basement to check on her and he sees her and he's like, and so he and Megan tells him that Casey has a DNR, a do not resuscitate. And if somebody has for a legit do not resuscitate, that is a legal document that it is notarized, it is signed, but it's not something somebody can just say. Like if somebody has an official DNR, that is something like it's normally a medical document. There is something called an advance directive. And often when people have terminal cancer, they often will sit down and do an advance directive where they say, I don't want to be on life support. Yes, I do want to receive comfort measures, where they'll go through all these different scenarios and they will say exactly what their wishes were. There's, to our knowledge, there's nothing like that exists in this case. It's just Megan's word that supposedly Casey wanted to die and that she had a DNR, but it doesn't seem like this is only on Megan's side, and that's where we don't know if that's completely true. Okay. Let's go here. So, the evidence includes over like 28,000 texts over 5 years between the victim and others. Let's see. And I do think, so this is a jury trial out in Utah, and the fact that Megan was a nurse. So, because if there is a DNR, if you arrive at the house and the person has attempted to, do something to themselves using insulin, you can inject glucose. So you can call EMS, and they're not going to use a ventilator. Like they could have possibly saved her life when Casey got there. No, when Megan got there at 10 a.m. So it's my understanding that Megan got to the house at like 10 a.m. And there is this there is this glucose monitor where there were readings taken before Megan got there. So that's where they do think that Casey on her own took her blood sugar level. But then the blood sugar is continuing to be monitored once it's below like 40, once it's below like it's at like 43 or something. And medical professionals said that normally a person would be very confused and they would have difficulty following commands once their blood sugar starts to drop to a certain level. So they suspect that Megan was the one checking Casey's blood sugar once it dropped to a certain point. The first witness was Casey's uncle. And he talked about how Casey's mother passed away and that she has an older sister, Kylie. And he is a type 1 diabetic. And he explained the difference between type 1 and type 2. And he actually had a backpack with supplies for low or high blood sugar. I think at one point his glucose monitor actually did go off, but he had just done something to manage whatever level was being tracked. He mentioned that Casey's mother died of diabetic complications and her father died of other medical issues. Multiple family members have died related to complications from diabetes, including in January of 2024, one of Casey's uncles passed after having 2 kidney transplants. There was a lot of insulin in the house, and he talked about that, like, they really didn't track. So, like, if there were some vials missing, he might not have, because there was just, so he has type 1 diabetes. There was the uncle with type 1 diabetes, and I believe there is I think it might be her grandfather, because I think the grandmother has dementia, and so I think it was the grandfather that also has diabetes. He talked about how Casey was born with 1 kidney, and she knew what to do when someone's blood sugar was low or high. At one point, the notifications for not the uncle that was testifying, but the uncle that passed, because he wasn't great at managing his diabetes. The notifications for his glucose monitor would actually go to Casey's phone. And then also, grandmother, my bad. Sorry, I got that wrong. So grandmother is the one that also was type 1 diabetic. And alerts would go to Casey's phone sometimes for the grandmother's insulin too. He talked about how 5 units is around a standard dose of insulin, and that 100 units would unalive someone. He also talked about how they had long-acting insulin, and that's insulin that helps the body manage sugars all day. And then they also had short-acting insulin, and that's what a person would take right before eating a meal. And uh on and so I think the uncle was also Mormon, and he talked about doing prayers and blessings for Casey, but never a blessing of release. And according to Megan's dad, he said that a blessing of release, because that's kind of like a going ahead and die blessing. He said that that goes against the church doctrine, but when I Googled it, it came up. So I don't know. Um, but I'll wait to get to some of Megan's dad's testimony. So Utah is not a death with dignity state. So there are states that allow for somebody that truly has a terminal illness, they allow them to be able to they allow them to, what's the word? There are some cases where somebody with a terminal illness is able to um go through a process where they can choose to die in comfort. And not every state has that. If somebody chooses to do it, they often have to get psychological clearance. They also they often have to administer the whatever they're taking, they have to administer it themselves. It's often recorded, and there are multiple chances for the person to decide that they want to stop the process, and they want to make sure that it's not, that somebody isn't coercing them to do it, because it really seemed like Megan wanted the life insurance policy. I'll get to some testimony that came a little bit later. So I'm seeing questions come in. And so Lisa, I starred your question. Sarah, I saw your super chat. And so I'm going to get to questions a little bit later. And so please hold off on the questions until I let you all know that my brain, so I'm not pinging all over the place. This case is very complicated, and I want to make sure that we're all on the same page. So then they had a witness interrupt the uncle's testimony. So the uncle finished his direct examination, but then they had the orthopedic surgeon was only available that day to testify. And he had some of his details wrong, but he's probably done a ton of surgeries, because he thought that the surgery was in 2025, but she died in 2024. So it was clearly July 24th of 2024. And he also mentioned, so she died in August. So he did a knee replacement surgery to improve her quality of life July 24th of 2024, and he indicated that there were no signs of severe depression or anything severe enough that would cause him concerns. It does sound like he wasn't aware that she had an issue with her pills, that she might have been getting things, because you're not supposed to take Xanax and opioids together. That can definitely cause problems, and so it did seem. And the defense tried to point out the fact that he maybe spent about an hour with her, and so he might not have known everything, but she did not tell her orthopedic surgeon that she had cancer. It seems like those things were only said to people that were friends or family. He was aware that she had a history of being diagnosed with anxiety, depression, and PTSD, and that she smoked a few cigarettes a day. I forget if it was, I think it was the state or the defense, um, because somehow it came up that he knew someone who had died at their own hands, and I think it might have, and they were going to start to ask more questions, but that was there was a sidebar, and um, questions went in a different way. So that was the gist of the orthopedic surgeon's testimony. He also said that he wouldn't have done surgery if he thought she was actively thinking about dying or harming herself. But it does seem like there were text messages where she's going back and forth with Megan about, but I don't know if Megan even knew about her knee replacement surgery. Like, I'm just very confused because we don't have all the messages yet. So we don't have a nice timeline of who knew what when. But on the cross-examination of the uncle, so the uncle that Casey lived with, um, the defense just wanted to know if she understood insulin. She had actually told her family that she was receiving hospice care, and Megan, and I wonder if there's going to be a call on her phone, because Megan says that she talked to a hospice doctor, and the doctor said, so like when Megan's parents get to the house and Casey's in the state, she tells her parents that she's already talked to the hospice doctor, and he said that, she's close, like to just wait with her. And but I don't think that was true. I don't think she talked to a hospice doctor at all. And so it'll be interesting to see what happens with the messages, phone calls, all of that data. But with the uncle that Casey lived with, information about insurance and life insurance came up, and it came up that Casey had stolen money from his parents, and they actually made a report of elder abuse to social services, but this was all after she died, because I think with it being that amount of money, and I think it was on credit cards, they filed a police report to, I think, be able to um because I think they reported it as fraud, like that they did not give her permission to use the card for that. And the uncle said that if she had survived, and if for some reason that was part of her motive, because the defense is making it seem like all of these things were about to come to light, all of these lies. And so that's why Casey did what she did. But Megan watched. And I don't know how you can get around the fact that Megan, a registered nurse, sat and she could have been saved, I believe. We don't know that for sure. But Megan gets there around 10 a.m. And let's say Casey did it to herself. We don't know if Megan injected her with the insulin or if Casey did it to herself. But either way, like, Megan was aware that because I think she had recommended insulin. Like, this is this is a bit problematic. They also didn't let anyone in the house know that this was happening. And because when the uncle was on the stand, they show a picture of the house and that there was a side entrance because Casey lived in the basement and there was a side entrance to the basement. And I think her visitors probably would, that made sense that her visitors probably would come into the basement to not disrupt or disturb the rest of the house. But it was, it was a lot. So then, um, the uncle continues and the state gets back up to redirect to talk about that there was no indication by the family that Casey had been thinking about ending her life. He was aware of her having anxiety, kidney issues, and retaining fluid. But so that's where things ended kind of with him. A toxicologist got on the stand and there was oxy in her system. Manner of death was undetermined, but but he didn't have all the text messages. He didn't have all of that information. So undetermined just means he couldn't say it was natural. He couldn't say it was an accident. He couldn't say it was definitely homicide. And he couldn't say that it was at her own hands. So the fifth option is undetermined. And that's because he's with medical and statistical accuracy, he could just say undetermined. And that manner of death would be a legal decision and not his decision. So that came out there. There was a nurse practitioner that was at the ER. And at some points, this nurse practitioner, so a nurse practitioner is almost like a medical doctor, not quite, but like they can write prescriptions, they can write medical orders, because you have a registered nurse and then a nurse practitioner has more training than a registered nurse. And so a nurse practitioner oversaw Casey's care while she was in the emergency room and the ICU because so Casey um survived for 3 days. So the incident happened on August 12th. She was removed from life support after 3 days. And I think that was after they determined that there had been significant damage to her brain, that she likely was never going to wake up. And they continued for 3 days. They were unable to stabilize her blood sugar at all. And um, so the victim lived, so there was a time when the victim lived with Megan. So Megan and Casey had been roommates. And then Megan got married and Casey lived somewhere else. And then Casey moved back in with Megan and her family. And then Casey's sister said that Casey said that Megan was trying to kill her. And so while Megan was out of town, her sister went to the house to get Casey's things and they moved Casey out while Megan was away. Now, Casey continued to have interactions and phone calls and things with Megan. I think Megan went through a divorce at some point because I believe she's separated. I think she's divorced. She does have a child as well. And this case is just it is a lot. It is a lot. Um, it is so much. And all right. And it's my understanding that there might have been Fanta right near her. And I don't know if the defense is going to try to say that if Casey was somehow injected with something and she didn't want something to happen, but you can't like inject somebody with something and watch them die. Like it's super suspicious, especially if you think that that you're going to inherit $1 million if they die. And so, yes. NPs. And so I don't know if this was a doctorate. I don't know if this was a DNP. And I don't know if all nurse practitioners are DNPs. I'm not sure. All right. But this nurse practitioner, she gave a lot of really good information that normal that normal blood sugar is normally 70 plus, and that when they first checked her blood, when they could get a reading on Casey, her blood sugar was 14. 14. And 43 is your out of it. Her blood sugar, by the time they could actually read it, the first reading they got in the ER was 14. Okay. Most diabetics can start to feel symptoms when their blood sugar gets around 60. She was admitted to the ICU and placed on a ventilator. Her blood sugar continued to drop, and they were never able to stabilize her blood sugar. The nurse practitioner did a good job explaining that insulin is the key that opens the door to let sugar into the cells. So our cells need glucose, or it needs sugar, but not too much sugar. Like, too much sugar is bad, not enough is bad. And so there is like a healthy amount of sugar that our body needs. And she said that insulin opens that door to let the sugar in. Most people, I want to say pancreas, correct me in the chat if I'm wrong. I want to say it's the pancreas that creates insulin. With people with type 1 diabetes, their body does not create insulin on its own, and they have to have a monitor. They have to inject themselves with insulin. They need continuous things. There was some things about healthcare that came up that was just kind of glossed over, but with the uncle's testimony, the uncle that Casey lived with, he talked about sometimes the insurance would only pay for a certain type of, so they would get whatever insulin the insurance would pay for, and that they had short acting and long acting insulin. They would also keep insulin after it expired, because if they were in a pinch, because he mentioned that insulin is made in China, and if there was ever a supply chain issue, they wanted to make sure to have insulin on hand. I don't know if any of that is true, but like him providing that info, like, it helps you understand why they had so much insulin in the house, because there were 3 type 1 diabetics in the house that needed short and long acting insulin. And insulin is really expensive. Extremely, and it shouldn't be. That's a whole other thing. And so this was just simply about, they need it to survive, and they would rather have expired insulin than not have anything at all if there ever was an issue with them getting their medication. That was something that came up that I thought was interesting in this case. Um, uh, uh, the nurse practitioner also talked about like type 1.5 diabetes, which I think, I don't know. So I am not an endocrinologist. So often people with diabetes see an endocrinologist. Also, people with thyroid issues, or like, there are different reasons why somebody might see that type of doctor. We also learn about nephrologists, which is for people that have kidney issues. But with this case, um, she mentioned the half-life of insulin, that the short-acting insulin lasts for a few hours, and that the long-acting insulin lasts for like 24 or so hours. And she also mentioned that she had a patient come in with a very low blood sugar in the 40s, was very confused, not able to follow commands. They were able to stabilize the person's blood sugar, and they didn't go into a coma. They didn't have any like brain damage or anything like that. Okay. Um and she was directly asked, "Would you expect a trained nurse to understand what to do in this situation?" And of course, she said yes. And the nurse practitioner said that Casey would not have died if sugar had been given sooner. She may have survived. All right. And cross-examination, defense lawyers do what defense lawyers do. So then there was a doctor that came in, and it was Casey's primary care physician. And I think the primary care physician had an idea that Casey might engage in medical attention seeking, that she might sometimes report symptoms that she didn't actually have. But he said that Casey was diagnosed with fibromyalgia, endometriosis, painful bladder, kidney issues, anxiety, depression, insomnia. She had had gastric bypass, so gastric bariatric surgery. She had an iron deficiency due to that surgery, and she never told this doctor about thinking she had cancer. Um, so they looked at, because she also reported having a bleeding disorder where her blood didn't clot properly. But when they did the medical test of her blood clotting, there was no indication that she had that type of concern. At one point, she was prescribed clonazepam and an opioid, and she was also on medication for weight loss that was only recommended for 6 months, but she had been on it a lot longer. And it seemed like this doctor was trying to like fix up her medications. She was not prescribed Xanax, and she started Cymbalta. And at some point, she was on Pristique, which is another SSRI that can be used for anxiety and pain. He talked about opioid tolerance, how that can happen with opioids and benzodiazepines, where if somebody is taking that type of medication on a regular basis, they can start to need more and more for it to help manage their pain, but that can create dependence on the medication. And so that's why they don't want people to stay on those medications for a long period of time. On cross-examination, he admitted that she gave information that was not verifiable. He called her a frequent flyer to the ER and admitted that she engaged in medical attention seeking and that she was referred for mental health, but she only went to maybe 3 sessions. There was a question of if there was a 4th session. So he had a real casual way. This if you go back and watch the testimony, this PCP, this primary care doctor, he was the most laid back guy. Like he was just talking. And I thought that was hilarious. So there are concerns of her overusing opioids, and then also she was taking Xanax, but she was not prescribed it. And so definitely some possible substance behavior, but yes. All right. Um, he also mentioned that she had been referred to an endocrinologist because she had reported low blood sugar to him, but she was self-reporting very low blood sugars, and he really, like, he just had her monitor it, but he really wasn't doing anything. But it seemed like he questioned, because when she got to the office, her blood sugar was always normal. And so question mark, dot, dot, dot. Okay. So that was, and I think that whole blood sugar monitoring thing was back in 2020. Okay. So Megan's dad testified. Okay. And he talked about adopting Megan when she was 4 years old. So Megan, I think, maybe doesn't have a relationship with her birth father. Because when he said she was adopted, I wasn't sure if, like, but his wife is Megan's birth mother. Okay. So, and she testified too. We will get to that in just a moment. He talked about how they were close. Um, and Casey and Megan, they used to work together. So that's how they met. They used to work together. Casey actually called him dad, and they met at a place called Chrysalis, and it was for people with disabilities. Casey would often spend time at their house for the holidays, and he kind of said that she requested a blessing of release, but that wasn't church doctrine. So instead, he gave blessings for comfort and healing. Once again, he is Mormon. And he also said that within the Mormon faith, you don't You don't unalive yourself. It came up in his testimony that he had a history of cancer as well. And when his daughter, Megan, found out that he had cancer, and he thought about not getting, because he had had mouth cancer 3 times, to the point of them having to create a tongue with like another part of his skin. He said where, I didn't write it down, so I completely forget where, but they had to recreate his tongue and he was going to need surgery again. And if he didn't get this surgery, he would have died. And Megan encouraged him to get the surgery and to save his life. But with her friend that supposedly had cancer, she decided she was encouraging her to not be here anymore and to just let go and to just end it all pretty much. And so, but I think I have to go back. I'm not going to go back and watch this case, cuz so we're going into day 4 of trial next week. So next week will be day 4 of trial. I think they want to have this case to the jury by the 20, maybe, because they were talking about definitely having court on the 24th. It seems like they, because the state is trying to proceed through the case and that they're trying to get this to the jury on time for the amount of time that she was doing this. So she didn't have hospice. It was a lie. So she might have like a home health aide that would come to help with her other medical things. So she was in the basement and people could come and go without the other people in the family knowing exactly who was coming and going. But she told her family that she was on hospice. Casey wasn't on hospice. For some people, The Body Keeps the Score can be a bit of a triggering book. Uh, but a lot of people, and there's some other books that are similar to it that talks about healing the body that can be really, really helpful. All right. All right. And so let's see. So Megan's dad, because the state kept trying on cross-examination, the state was trying to see how much of this did you learn from Casey or did you learn from Megan? And Casey had been talking about having terminal cancer since around 2014. So for 10 years, she had been talking about having terminal cancer. And even Megan's mom said that the first time Casey really looked sick was on August 12th, the day that she had the medical emergency. And so, um, oy. And then there were question marks of, I think maybe Casey paid for a trip for Megan, and because it was Megan's mom's 60th birthday. And Megan's mom thought that Megan and Casey paid for the trip to Disneyland, I think. I want to say it was Disneyland. So California paid for a trip to spend a week there. Uh, but the state seemed to think that maybe Casey was the one that paid for the trip. It wouldn't matter. Like that's not like, that's just a small detail. But yeah. They also talked about how Casey needed attention and love, and that uh Megan has never said that Casey did it to herself, and that there's no such thing as a blessing of release, just a blessing of peace and comfort. Um, she actually told Megan's parents that she was so sick that they recommended that she not have visitors for 9 months. So around December or so, this whole case is just confusing. That Casey told Megan's parents that she couldn't have visitors because her health was so bad, but that wasn't true. It wasn't true. And so just because somebody lies doesn't mean that they should die. And so if somebody is coming to somebody saying, I have terminal cancer, you don't say just die already. Like that's weird. That's weird. Like, you might say something encouraging, you might just listen to the person, you might just be there for them. From the messages, it seems like, especially towards the end, as Megan's financial situation became more dire, she started to push Casey more of when are you going to do the thing with the insulin? And so we'll see how those messages play out because that's of course the state's narrative. And the defense's narrative is going to be that Megan was exhausted with Casey, but then like set a boundary. So there were no boundaries in this relationship, no boundaries whatsoever. And um, Megan, I think, was trying to take care of her, but not in the right way. This was not healthy at all. This was very toxic. And we're going to keep going with more testimony. So there was a juror that was excused. Anybody in the chat know why juror number 1 was excused? I think I missed it. Did they talk about it? Exactly. In this case, we're going to be like, what's boundaries? So I'll pause. If y'all have any questions so far, let me know if you all have any questions. I'm going to go to my starred questions. I forget like um if there if there were repetition compulsion at play. So just wondering if maybe there was repetition compulsion, but I think Megan was the one that recommended insulin. So, Dr. Berry, do you think losing her parents to medical issues affected her fictitious disorder? So it was probably a family that spent a lot of time going to the doctor in the hospital. She had the port, and cancer survive, like cancer, people that are going through cancer treatment, they often have the port to receive their chemo. I also wonder if she used it to get away, like to not have to do chores, to because at the time of her death, she wasn't working. And so I wonder if it was like, I'm so sick, I can't work. I'm so sick. All I can do is lay in my recliner all day and watch TV. But like, yeah. But she was the one doing the harm. Allison, great question. But I don't, because if it's your friend, would you be a mandated reporter with a friend? So I personally, if I had a friend telling me and I was concerned that they were going to harm themselves, I would make sure that they got help. But isn't she mandated to do something? If she arrives to the person's home at 10 a.m. and then by 1 p.m., she's asleep and she can't wake her up because Megan texts her mom to cancel dinner plans saying, like, I'm here with Casey. Casey's not doing well. And that was at 1:30. Megan's parents come over to the house sometime between like 7:30 and 8:30, and they just sit there with Casey for like 30 to 40 minutes until the uncle comes. And he gets there and he's like, "What?" And he calls the ambulance. They leave immediately. But so Kylie on the phone, because the uncle calls Kylie because they're saying there's a DNR. And the uncle's like, if anyone would know about a DNR, it would be her sister Kylie. So the uncle calls Kylie and Kylie's like, who's there? Megan? And Kylie, probably on speaker, says, Megan's trying to kill Casey. Get her out of there. Something to that effect. So Megan and her family leave. They watch the ambulance arrive, but they leave. And I think the police and immediately start investigating it as a potential crime. All of this is real. You have to I watch so many hours of court. It was yesterday in between clients, and I think last night I finished up video day 3 of trial last night. So, Megan's mom. So, Megan is the oldest of 3 children. She has a very close relationship with her mother. Casey lived with Megan from 2014 to 2016 and then 2018 to 2020. Casey's grandparents, so According to Megan's mom, she thought that Casey moved in with her grandparents because they allowed her to come and live with them. But Casey's sister is going to say something different. They talked about the Disney trip and, uh, yeah, Megan's texting around like 1, 2 o'clock saying that Casey is asleep and she can't wake her up. And the mom tried to make it sound like the breathing was normal, but the sister hearing the breathing over the phone brought her to tears because it reminded her of when her dad passed. And so, like, ooh, um, ay. And so the mom tried to say that Casey's breathing was similar to, like, her needing a CPAP, and so she wasn't concerned with her breathing, but I don't know. Okay. Ooh, the defense brought out a message, and I think they brought out this message to Casey's mom. There was a very long message that the defense read of Casey talking about her medical, but I think Megan entertained it and never set a boundary with her, and I think there's a problem with that. So because of the allegation, so if Megan is found guilty, if she still does have a nursing license, but the jury is not gonna know that Megan was fired from her job because of maybe something ethical. I don't know. I don't know if it was, but there was something that happened because the state was trying to get a portion of a message in, but because they want the jury to know that Megan didn't have a job at the time. So they want to make it seem like she left a job, but Megan was fired from a job because of some issue. But they could definitely go for the state licensing board if she is convicted, or maybe even just with the charge of you sat with somebody in a diabetic coma for hours waiting for them to die, thinking you were going to inherit over $1 million. Megan is the defendant. Casey is the victim. All right. Yes, yes, yes. Exactly. All right. Let's see. Going back to the notes. So then Kylie's sister, very emotional. Kylie, Casey's sister. So Kylie testified and she talked about how their mom died in 1989. Um, and then their father died in 2011. And she was able to be in the courtroom because often they designate one family member to get to um, support or like to be there. So like the victim advocate works with everybody, and they allowed her to stay in the courtroom during the other testimony. The defense is going to bring that up later, but it is what it is. So there had been prior testimony by either Megan's mom or dad that Casey had alleged that her family was emotionally harmful. And Kylie says that there was no emotional harm, that they communicated daily, that Casey said that she had leukemia beginning in 2015. She had a port, she had medical supplies. Kylie would pick up her prescriptions, and I guess she just wasn't nosy enough. So I'm a nosy person. You send me to pick up your prescription. Now I'm not going to open it or anything, but I am going to look at the bag. I mean, like it's going to be because I'm going to make sure, because I know I'm going in for your prescription, and I'm going to make sure that I get you the right prescription. Um, but yeah. Um, Surgery was meant to improve Casey's quality of life. She was aware of her sister's anxiety and depression, and that her sister would have panic attacks in the middle of the night. That might have been why she used Xanax too. Often people that have panic attacks, I try to get them to do something else. because Xanax can be habit forming. So I try to get people, if they can, and I'm not a medical doctor, I don't give people medical advice, but if they can, work with their doctor to be on something different. I've also worked with people on with chronic pain. Chronic pain can make a person have thoughts of not being in pain anymore. And it definitely did seem that uh so the knee surgery was confirmed. Her X-ray, MRI, all those things. She had a grade 4 osteo. I wrote it down earlier, but it was bone to bone. Her and so she had knee replacement surgery on one knee, and she was scheduled to have knee replacement surgery on the other knee because that knee was grade 2 to 3. It wasn't quite as severe as the other one, but she had to heal from this surgery first before they moved on to the other one. The orthopedic surgeon also mentioned that he called the family because they were notified of a death and they have to report. If somebody dies within 90 days of surgery, that's something that's tracked in their system. And so he did call to follow up to see what had happened. Osteoarthritis, I think that was it. I can scroll back up to look. Uh, doo, doo, doo. Let's see. Yes, osteoarthritis, bone on bone. Yes. So the right knee was replaced and the left knee was a grade 2 to 3 and 4 is the highest. 1 to 2 can often be managed with physical therapy, injections, things like that. 2 to 3 is often requiring surgery. Um, he tracked her ER visits and things like that. But yeah, all right. So the sister also talked about that she thought her sister's health was bad. She didn't have a car, didn't have a job, didn't have any energy, and that increased her depression. But she also said that there was no plan or intent to die at her own hands. She said that within the last year, Casey had been happier. She thought she would have told her best friend, Michelle. So, ooh, there is shade in this trial. Okay. So the shade, so Megan is making it seem like she was Casey's best friend, but Kylie seems to think, and I don't know if Michelle is going to testify, but Kylie seems to think Michelle, who is some other rant, like we haven't heard any testimony from Michelle, but Kylie was pretty much saying that Megan was not Casey's best friend. Now there were a whole bunch of messages between them, and I think Megan entertained or gave her that medical attention, but it was in a way of saying just go on ahead and die, which was that's a bit problematic for me personally. But all right. Um, and her sister never told her that she had a DNR. And on cross-examination, the defense is just going to bring up the fact that that Casey lied about cancer. They also questioned if Casey was lying about being afraid of Megan, because that makes their client look really bad. So the defense is always going to try to attack anything that makes their client look bad. And Kylie was pretty adamant that Casey was afraid of Megan. Now her behavior, now there could have been some type of trauma bond, and I don't know what the mental health experts are going to say. I am excited to hear mental health experts, like an actual expert that has reviewed all the messages, they can't diagnose Casey, but they, I think, are going to come up with a general idea of what type of personality structure and what might have been happening. I do think fictitious disorder. So it used to be called Munchausen. Munchausen by proxy is when you do it to somebody else. Munchausen is when you're faking like when you are believing you have an illness. I thought it was interesting that Casey didn't tell her doctors that she had cancer, but I think that would have been easily proven. So she was only telling this to people that she could get sympathy from and attention, love, support, but it was friends and family. She never said that to any of the medical doctors. Um, and so in general, I wanted to talk about the reasons why somebody might fake cancer. This has come up on social media. There have been influencers that have done this. This has happened a lot, and that is the fictitious disorder imposed on self. And there's often a deep need for attention, care, and sympathy, wanting to feel important or special, seeking the nurturing role, often given to sick people. So being taken care of. Like if somebody thinks you have cancer, like they're going to, cater to you and all those things. Being validated through the identity of being ill, and some individuals will go to extreme lengths, including falsifying medical records, shaving their head, or even undergoing unnecessary or even painful medical procedures to maintain the story. Okay. Um, Sometimes there can be aspects of personality disorders, so specifically histrionic personality disorder, and that's where an intense need to be the center of attention. In extreme situations, someone might fabricate a serious illness to maintain attention, admiration, or emotional reassurance from others. Common underlying needs are fear of being ignored, emotional validation, or a dramatic expression of distress. Narcissistic personality disorder is another like one. So I'm going through all the reasons why somebody might do this. And so somebody with narcissistic traits might do this to gain sympathy and admiration, to maintain a sense of importance, to avoid criticism or accountability. And the illness narrative can help preserve a fragile self-image. Sometimes there can be secondary gain. So this came up in I forget her name. The girl whose mother pretended like she was sick and then she like killed her mother. So sometimes there can be secondary gain like financial donations, avoiding work responsibilities, escaping legal or social consequences, maintaining a relationship. In these cases, the behavior might align more with deception or malingering than mental illness. So some people fake being sick, but it's because of deception and malingering. There isn't an underlying mental health issue. Sometimes there is. In this case, it it could be a mix of all of these things. I don't know. Sometimes there can also be trauma and attachment issues for some people with histories of neglect, inconsistent caregiving. Illness can become a learned pathway to connection. If the only time somebody received attention growing up is when they're sick, it can have them unconsciously or subconsciously associate illness with love and safety. Sometimes it can also be identity and emotional regulation. Sometimes the illness story becomes a part of a person's identity. And so it explains their personal struggles. It gives them a role in their social group, and it gives them relief from feeling ordinary or invisible. And so it's really important to note that there's often deep psychological stress, unmet emotional needs, and personality dynamics at play. All right. So, some other things that can kind of underline it, sometimes unresolved or complicated grief. So, feeling emotionally stuck in a period where a loved one was sick can sometimes have a person recreate aspects of that experience subconsciously. And I think that's what Lisa's question, like, was she recreating her parents' sickness, especially since they died of complications related to diabetes? Sometimes it can have a person seek the same level of closeness and attention that comes around illness. Adopting that sick role becomes a way to reconnect with the emotional environment they associate with love, care, and family closeness. It can be a learned association with illness and attention, um, a way to identify with a deceased loved one, trauma from medical experiences, health anxiety, and catastrophic thinking, or grief-based identity shifts. And so, how you help somebody that's in a situation like this. The first thing is to say, I'm worried about you and everything you're going through, but not talking about the medical thing. So first you want to connect with the person, encourage them to get professional help. So fictitious disorder can be treated, but often meeting those unmet emotional needs, addressing any trauma history, addressing the attention seeking behavior, loneliness, depression, do not reinforce the illness narrative. And so, one of the hardest parts is not reinforcing the role of being sick. So, avoid sharing the story with others as facts, avoid fundraising, like really helping them get attention for other things and not only for being sick. Set healthy boundaries. I care about you, but like I'm not comfortable participating in medical discussions without a doctor involved. Like this is really a better conversation for you and your doctor. Boundaries protect you and the other person from escalating behavior and from enabling harmful behavior. To me, the relationship between Megan and Casey seemed really codependent. It was very problematic, very, very problematic. Let me know if y'all have any general questions. Let me know if you all have any. Yeah, so repetition compulsion isn't a diagnosis, but it's something that we sometimes talk about in psychology. Uh I do not know who Mary Beth Tanning. I would have to look that one up. Thank you, Peachy Keen, for gifting a membership. You all are the best chat. Do, do, do. I wish we could all be kinder to each other. I know. And so, yes. Um, this case can be really triggering for anybody that does have legit medical concerns. And even though Casey was feigning cancer and all of that, the problem came when Megan encouraged her to die. Okay. So Megan was pretty much like, your life is not worth living. Like you should just give up. Like Megan was encouraging her, hey, you're gonna die anyway. No use being in pain. Cause I think Casey would reach out to her complaining about her pain, complaining about all that she was going through. And Megan was like, you don't have to go through that. And that's like, that's not, especially if you think you're the beneficiary of the person's life insurance policy. So, with the obstruction of justice charge, it's my understanding that Megan deleted hundreds of text messages from her phone. But guess what? The state has Casey's phone. So, when they compare Megan's phone to Casey's phone, there are messages missing from Casey's phone. I'm sorry, from Megan's phone, from Megan. So the defendant here deleted some of the messages about insulin and about some of those plans and all those things. And that seems like consciousness of guilt to me. Why are you out here deleting messages? It's a little suspicious. It's a little weird. Hate me. If you're going to be a friend like this, I don't need it. I don't need it. Yes, I am going to continue to follow this trial. I think it's going to be over either later next week or the week after. I definitely want to hear the medical testimony. The psychological, because I think the defense has an expert that's going to testify. I do think the defense is going to try to paint the victim, which some of this might be true. The victim might have been, sounds like she was, overusing prescription medications. She might have been attention seeking. She might have thought of wanting to die at times, but Megan facilitated it. And that's illegal in the United States. You can't do that, especially, and you're a registered nurse. So you can't say you didn't know. Like, and you knew if she did do something to herself, you knew what she might use, because I think, Megan, you recommended it. And so, like, it's a whole thing. It's a whole thing. Don't be suspicious, don't be suspicious. Um, all right. And, like, so, Lisa asked about, there is a football player that was recently arrested for the death of, I wanna say, his girlfriend. Let me look that one up, because ChatGPT, for the first time, I haven't heard a trial where ChatGPT, football player arrested. So let's talk about that one real quick. So ex NFL linebacker is charged with unaliving his girlfriend. He asked ChatGPT for advice before calling 911. Now, what he asked ChatGPT, because I think he, like, wanted to ask a neutral question that wouldn't insinuate he had done a crime, but, like, you can't be going to chat before you call 911. So, I will be following this trial. I think he hasn't, because I think he was just arrested. It might take a while for all of this to go to court, but he's alleged to have sent messages one day before authorities were summoned to the couple's home and discovered her body. And uh the message, and he also has a history of DV against other women. They all survived. She did not. And so um he asked the chatbot Allie, what should I tell my friend? No, okay. So this is how he wrote it. So this is not great English, but that's okay. What should I tell my friend to handle someone non-responsive but wants to call the police? Well, you should call the police, sir. And so ChatGPT has now entered as a new thing, and um yeah, he asked it for advice. But I think this generation, because some people do ask their chatbot, but call 911, but I think he was trying to get away with a crime, because the situation sounds really bad. It sounds very, very bad. And uh so yeah. If you didn't follow, so I did a video talking about the TikTok psychic that my brain, she has a $10 million judgment for falsely accusing an Idaho professor of a crime that she did not do. And so I did a video talking about that and why sometimes people won't admit the truth. Y'all have been amazing. Will ChatGPT have to testify? So I think they have probably subpoenaed the chat, or it's on his phone. So, because I think he did it on his phone, and so those records are going to come in. The whole asking for a friend, like that, sir, I'm just like, it wasn't about me. I'm asking for a friend, but I wonder if he wasn't sure, like, if chat has to report if people have done crimes, or if people are, I don't know. Like, it was a whole thing. It was it was a whole thing. I heard she's going after Atozi. You did spell it correctly. I think Atozi will be fine. Uh and I think he's used to it, because I feel like, because he covered, is it Johnny Sommelier? He covered that one, and I'm sure, like, Johnny would say stuff too. I think Atozi, he's ready for it, but because I don't, what she's claiming, I would have to see evidence. It doesn't seem like something Atozi would do, because she's claiming that he called her, and I don't think he would do that. I could be wrong, but yeah. The asking for a friend. Oh, it's common. See, I wouldn't know that. I wouldn't know that. Yeah, he's been- he's he's gonna be all right. And I think he's gonna wait for the legal process, because I haven't seen Atozi talk about it, but he might just be, like, putting other videos together, or his lawyer might be recommending to not do anything until things move forward. Yes, Johnny's Somali. Yes. Thank you. Yes, yes, yes. Because he's in jail. I follow, so I follow Atozi, I follow all these people. Oh, and thank you to JD Lawyer Explains. He does like short videos. He has this like beach background that wants me to like, I want to be in Hawaii or something. He gave my channel a shout out. And so if you're here from his channel, welcome. Thank you so much. We have fun here. We nerd out about psychology and true crime. Somebody asked me to talk about Love is Blind, and it just keeps getting worse and worse. This season, I didn't even watch because before the season even came out, there were women alleging like they had bad experiences with one of the contestants. And so I was just like, I can't with this show. And I think one of the couples that was successful like didn't get as much airtime, and the show doesn't work. It doesn't work. People go on it to just become famous. Like that's why some people do it. The guy that now has like a pregnant fiance, I don't I don't know how true his intent, like I think he wanted to stay on the show for the full amount of time, but I think he knew as soon as he saw uh his match that he wasn't going to go forward with it, and he dragged her on anyway. And so I just can't. I do think there's going to be a Love is Blind documentary similar to the America's Next Top Model documentary. I do think that will happen. There will be former contestants that talk about, because there have been lawsuits against Love is Blind, and now like they don't, because one season the contestants alleged that they were only provided alcohol and they weren't provided water. Like they were only given alcohol. And there have been a lot of different allegations about things on the show. And so I do think there will be like a deep dive into that show by somebody at some point. Um, I did also see that a contestant from uh The Amazing Race, because I followed that season because it was an African American couple. The husband was portrayed like a villain. And he later came out and said that he had been diagnosed with autism, but they are suing The Amazing Race. And so if that court filing, if more information comes out with that, I will definitely keep an eye on that too. A person can get a bad edit. So I will never go on a reality TV show because reality TV, it's not reality. Like they script it, they intentionally cut things out. They want to tell a narrative and they want to make it a show. This is not reality. And so sometimes they will intentionally pick, okay, this is going to be the villain. Like they've watched it all. And then they have a villain cut. And they have, the drama friend. They have the overly emotional. And then anytime that person cried, they're definitely going to include that in the final cut and make the person look emotionally unhinged. When other people might have been falling apart too. So reality TV is not reality. I do like it though. I do watch. But I keep in mind, this isn't real. This isn't real. And it's cheap. It's cheaper to make than like a scripted show. And so that's why reality TV isn't going anywhere. Family shows, people often get divorced. I saw one of like the Mormon wives, Secret Lives of Mormon Wives. I think one of them is going to get divorced, which doesn't surprise me. A lot of that show was, I wasn't a fan. I didn't make it through one episode. But often when people have their whole life on TV and for cameras, and the cameras are recording for 10 to 20 hours a day, there are going to be problems. NCIS, yes, I love NCIS, warned us about media taking things out of context. I think I might have missed that episode, but I loved NCIS. Yeah, yeah. Reality shows, they're not real. I did finish Bridgerton. It was okay. It was cute. It was a Cinderella vibe, and I like that. It seemed like the last episode, they did way too much. Like, they tried to wrap everything up in a bow in, like, 1 episode, and it seemed like, could y'all have just made it more episodes? Like, I felt like they tried to do too much. They drew some stuff out. It looked and then they did too much all in the last episode. But I watched it. I enjoyed it. So, it is what it is. I am so glad I got to hang out with you all. I will see you all next time. Be kind. Don't do crimes. I have to get my state inspection. My state inspection expired in February, which is not good because it's March. It's like March 14th. I looked at my car and it said 226 and it should say 227. Now it's going to say 327. So yeah, I'm going to get my state inspection on Monday. I'll see y'all next time. Have a good one. Bye.